All right, welcome back to Daybreak on this 15th day of June 2020. We'll shortly be speaking to the governor of Machakos, Dr. Alfred Mutua. But before we do so, let's take a look at the state of the war. We are talking about the war against the coronavirus pandemic, and I want us to take a look at the numbers that we have so far and how the trends have been. And the first one is that now we have 3,594 confirmed coronavirus cases. Out of that, 1,221 have recovered. The deaths, they're actually now 103. The day before yesterday, there were 100. And the active cases, therefore, at 2,270. And the total tests so far conducted 115,000. After that, we know that the past 1 week has been the worst if you're to talk about the situation with the coronavirus in the country. And this is why. The cases on the 7th of June, that is a week ago, were at 2,767. But now we are reporting 3,594. That's an increase of 827, and 16 people, actually 19 people have died during that season. But also it has been the best week when it comes to recoveries, because now that 1 week, 469 people were discharged from hospital isolation facilities. Talking about the weekly tracking, the case looks it's been worsening, because if you look at the first 10 days were 27 cases, and then now we know that from week 10, if you look at it, we had 327 cases, and then week 11, 805, and the week that we just concluded had 827 cases reported. So it's worsening, and the reports we have from the Ministry of Health is that we are not yet at the peak. The cases continue to rise, because if you look at the month of June, we have reported 1,632 cases. That is way higher than the month of May, which many thought that was the worst, because in the month of May, the entire 31 days, there were 1,566 cases. Now, June, we're just at the mid-mark. That is 14 days into the month, and already reporting 632 cases reported. And to speak to us about this is Dr. Alfred Mutua. Good morning, Daktari. And when you look at...
Good morning. Habari asubuhi?
Njema sana, hakuna neno. Na wewe, uko wapi? Uko nyumbani ama uko White House?
Tunaelekea White House.
Okay, of course.
Ukisema White House, you only remove the white, unaweka state baadaye.
That's interesting that you should say that. But let's begin with the situation that we now have in the country of the coronavirus disease. It's worsening as you look at the numbers that at the half month of June, we are reporting more cases than we did in the month of May. How have you seen the trends in your county comparing the month of June and the months before?
I think it comes down to two things. One is that we are testing more than we were before. And also the fact that it's getting colder, and we're getting vigilant and better at identifying people who are ill. But I think the most important thing is, if we look at Machakos, for example, we are one of the testing centers at Machakos level 5. We've tested over, close to 1,500. We're going to close to 2,000 people that we are testing. We also, this is because now we're getting people, as we think about reopening the economy, people work in the service industry, restaurants and others need to be tested. So we're getting more and more people coming in now for testing because they need it to go to work. And it's just a matter of figures. But I know the trend is growing, but it is not yet alarming from where I sit.
Right, it's not yet alarming. But now I was looking at the numbers and saying that Machakos County, I believe it was some days before the end of the week, you were at 14 infections in number. Do you know the latest number as of now?
No, actually, the positive cases in Machakos are 26.
26.
This is our data is 26.
Okay.
And they are spread over. And this also includes some foreigners from Tanzania who are stopped. Because what has been happening is that when people come in from Malaba or they come in from Mombasa, when they get to, by the time they get to Machakos, we get an alert. We are told that there's somebody who is positive, please stop them. And that is why now we've taken the motion that people should not leave Mombasa or cross the borders before they get the certificate. So we've been stopping them and then isolating them in Machakos. But we have community spread, especially in Mavoko area, and that is really concerning to me. Mavoko area, we had our first case was just in Mlolongo, and another case in Syokimau, and then now we've now getting families, a whole family, you know, being positive. We're getting whole communities or whole areas whereby neighbors are becoming positive. So it's starting, that community spread, I can say, is actually in Machakos County.
Okay, community spread you call it. But Governor, we have not been lucky to get information about the transmission chains. I remember the few that we got from the Ministry of Health were talking about the transmission chains in some parts of Nairobi, Kawangware, Parklands, Eastleigh. I don't know what's the pattern in Machakos, because yes, you say the community spread is happening, but how are people infecting each other? Is it through travel? Is it at the family level?
I think it is. It's dual. One is majority of our infections, when we've tracked them, have either come from Nairobi or from the coast province. And what is happening is that truckers would come to Mlolongo, and they would start hanging around Mlolongo, you know, talking to border guys. There was even this habit of they come, they stop the lorries, and then they entertain themselves with street girls. You know what I mean? And so as a result, that kind of infected. You get somebody who's infected who takes it home, infects their child or infects their mother, and then it spreads that way. But we don't have that mass spread whereby you find in a supermarket or in a market and all that. It's because people actually are wearing their masks and we're enforcing. But the one that really challenges me is because we have somebody who came all the way from Mombasa, actually from Tanzania, crossed the border to Kwale, through Mombasa, all the way to Kadhiane, infected people who are his relatives. But this is a person who crossed the border when there was lockdown.
Right.
Now, we have a case 2 days ago from Massi, you know, where I was born, in Massi. This is a guy who just showed up in Massi the other day, but he lives in Kayole, in Nairobi. So the issue of a porous border where people go back and forth. The other day I met a friend of mine, not really a friend, but an associate, and I asked him, Bariako, I thought you were in Kisumu. I said, yes. I said, so how do you make it Nairobi? You're not part of the essential services. And he said, well, if you have money in Kenya, you can go anywhere. So we've got that challenge. You know, these are diseases where people are traveling from Kayole, they go to a small village, now they have infected people in a village. My question is, how do they cross? And that is why this morning I'm chairing a security committee meeting with the county commissioner, the police commanders, our commanders. We need to find the solution because people should not cross.
Right.
I was at the border point yesterday, and the number of civilian vehicles has increased tenfold. Everybody now is an essential worker. Everybody knows an essential worker somehow. People are getting letters, people are getting excused, and so this is going to be a problem to us.
All right, that's interesting that you should say that. But let's focus on how you've been able to deal with this pandemic, and especially the positive cases so far confirmed. So of the 26, how many admitted in your facilities? I know you have a 200-bed capacity at the Kenyatta Stadium. Are they admitted there, or where are they? No, we actually, it's interesting, but only 5 are admitted in Machakos. Others have been, you know, what used to happen is that maybe you come from Lolongo and you go get tested in Nairobi because you want to be, you are being tested in Nairobi for COVID so that you can get your job back as a restaurateur or whatever. When you're found to be positive, you're not allowed to come back to Machakos. So you're quarantined or you're isolated in Nairobi. So we have 5 cases, 3 of which are Tanzanians and 2 are local. But we're getting more and more now. We expect to get maybe about 10 by this week who are in Machakos. Machakos, we have 373 isolation beds that are ready across the county. We are building now the map. Within a week, we'll have 5. Within 2 weeks, we'll have 500. By the end of the month, we expect to have about 1,000 beds as per the directives with the Ministry of Health. So we are being prepared. We are getting ready. The good thing is that we are not seeing many deaths. We've buried 2 people who are from Machakos, but they did not die in Machakos. But we are not getting many deaths. But I'm worried as we approach the cold season. Okay, so when you talk about these people, the 5 people that are admitted at your facilities, would you know their status in terms of, are they critical or are they still exhibiting mild symptoms?
Actually, they are all asymptomatic. None of them is exhibiting any illness. They just look as healthy as you and I. We're worried about one, the one who came from Kayole to Massi. He's got tuberculosis. And so as a result of that, now we're worried about him. Actually, where we've placed him, we've quarantined him even more. We've isolated him from the other patients because of his tuberculosis. We want him to, because when you've got tuberculosis or such conditions that affect the lungs, chances of getting severe and critical are very faster. We even prepared a special room just for him next door with an ICU, with a ventilator and everything in case he becomes sicker, because his condition may worsen as a result of his pre-existing tuberculosis condition.
Right, and when you talk about the question of, because at the national level there has been, you test, then you trace, then you treat. So when you're talking about contact tracing, is the county doing it, or is it something that has been left to the national government, and how successful have you been?
It's a collaboration. The national government at the beginning was hogging everything. They thought that they could only do it, but now it's a collaboration. You know, we work together. I chair the committee that is handling the COVID emergency, and we're able to track. We have our ambulances, we've got our officers, we've got our PPEs. So we're working with the national government where we are able to track people. So they give us information that they have found somebody in Nairobi who has tested positive for the disease. So we're able to send our teams to the ground, get the family. The first thing we do is quarantine them. Even as you contact tracing, anybody who's been close, you quarantine them. After you quarantine them, you test them. Then you keep them in quarantine until the results come out. And then you still have to quarantine them. We have 105 people currently in quarantine in Machakos. You have to quarantine them until after 14 days, where you test them every week to ensure they did not get the disease before you can now let them be cross.
So are they in self-quarantine, or they are being quarantined by yourselves as government?
It's both. We have got some in quarantine where we are holding them, and the others that are self-quarantine, but we're monitoring them. The problem with some people is that when we tell them to self-quarantine, they self-quarantine for 1 hour, and then after that you find them at the shop drinking alcohol, you know, illegal alcohol. You find them hanging out, you know, especially the young people. So some of those people, we have to force them to be in quarantine so they don't infect other people.
Okay, all right. Let's talk about, sometimes last month, some money was released to the counties to the tune of 5 billion shillings. I don't know what your share was, but what are you putting into, bearing in mind that you just have about 15 days to the expiry of the current financial year?
Yeah, that is the challenge. I mean, we got our money last week. We got 183 million shillings last week, and I want to thank the government of President Uhuru Kenyatta. They have really worked hard and worked with us. I think his appointment of former Senator Mutai Bega was brilliant. I mean, it's a brilliant choice. He's the best person right now in this country to fight COVID. He's shown exemplary leadership. He's a very good man in terms of teamwork. But we got the money late because Treasury released it late. We've got 2 weeks. We're even discussing as governors, when you look at the procurement procedures, will you even be able to procure within the next 2 weeks without people getting into trouble because they'll be told you jumped a step and all that. So we have written, Machakos has written to the controller of budget. And what we're asking the controller of budget is, let us transfer that money into a CRF account, to the county account, because that money does not go back, does not revert back to Treasury. So we transfer that 183 million into our account as a county, then we have time now to procure. But if that money still remains at the CBK under the Ministry of Health, even though we have an AIE, that money will revert back to Treasury, and then we'll lose it. And then we'll not be able to utilize it properly to fight COVID-19. So we hope that the control of budget moves with speed and approves that today. Yeah, because, you know, we are trying to work with her to encourage her to move a bit faster than she has been moving, especially at this critical period. But our letter is sitting on our desk, waiting for a signature, so the monies can be transferred so that we can procure. Because like Machakos, I want to quickly up my game. I want to get an additional 10 to 20 new ICU beds, because that is what is most important, the ICU beds. Because when people start falling very sick and getting severe and critical in July or August because of the cold season,
Okay.
they will need the ICU beds, and they don't want to lose anybody in Machakos.
All right, Governor, of course, Machakos County is one of the 4 universal health coverage pilot counties. You had finished your 1 year, and sometimes this year we were supposed to roll out. I don't know how that has been affected by COVID-19. But even as we move forward, what do you think it will take the county government of Machakos to be in a position, yes, to deal with the coronavirus pandemic, but also not to forget your mandate? It's bigger than health.
Yes, it is bigger than health. I mean, this is has slowed down the economy terribly. People are suffering. People don't have food. People don't have. People are not working, and so it is a balance. We will have to learn to live with this disease. But for me, the most important thing is let us slow it down. I'm looking at the curve. The curve is going up. We should have more people recovering than people getting positive, and so the reason is that there is a blatant disrespect and indiscipline in this country when it comes to matters of COVID-19. This is because of 2 things. One, some people don't really trust, they don't really believe the government when we say that it's COVID-19. They think it is just a machination to make the rich people richer and the poor people poorer, as has been since independence. And I don't blame them, because our economy is in shambles, as you know. Our politics is all tribal-based and block-based politics. Our, there's not been really an economic political movement in this country. Right. So people get very, very skeptical. The second thing is just our general indiscipline and lack of proper law enforcement, whereby people can get away with it. We've known in the books, for example, that if you're riding a motorcycle, you should wear a helmet, because it's about you, it's about the skull. But how many boarders today drive around without helmets, and a cop just waves them by? There's a total disregard of minor rules in this country. So people are not wearing masks as they should. People are not keeping, spacing themselves from each other as they do. So there's that laissez-faire attitude. And that is why this disease is not slowing down. So if it continues rising, I foresee a position whereby the national government, President Uhuru Kenyatta, may force a lockdown in this country for 2 weeks, where you can't get out of your door, to get people to behave. And it's unfortunate if it gets to that, because we should be able to control ourselves before we get a lockdown. All right.
Thank you so much, Governor Dr. Alfred Mutua, for speaking to us from your home. I don't know if it's in Machakos or it's in Nairobi, but all the same, asante sana for speaking to us. That has been Dr. Alfred Mutua speaking to us about the situation of the coronavirus battle in the county of Machakos. And up next, we'll be speaking to the governor of Nyeri, that is Mutahi Kahiga. He'll be speaking to us about what he's been doing. And of course, yesterday, they were graced by the visit of Mutahi Kagwe, the Cabinet Secretary of Health. We have that conversation shortly after this break.